it's a beautiful day to be a physical therapist. Let's go save some lives. Hey, come on in. Welcome to my home away from home. Got these to spruce up the place, you know, really make people feel here. Oh man, what a beautiful morning.
Good morning, Dr. King. You have a very busy schedule today.
Thanks!
You're welcome.
Hello. So, it looks like I'm seeing 3 back-to-back cases of hip dysplasia this morning. I actually have some pictures pulled up. So, this is x-ray of a 1-year-old. You can see the shallow acetabulum. This is what the baby was born with. You can see it's a baby because of the way it is, and also because of this lack of growth plate right here, as well as the rest of the skeleton. If we look over here, you can actually see in this 3-year-old that the femur has translated anteriorly, or is not anteriorly, superiorly, and then this one is still shallow. You can see the growth plate here, but again, a shallow kind of flat head of the femur. Let's go get some patients. All right, baby Carlos?
Yes, we're ready.
So yeah, Doc, something's wrong with him. My poor baby, he's been having a lot of stress.
Yeah.
When he was born, we did a lot of tests, but I just don't know what's going on. Maybe you can take a look.
Yeah, so this is baby Carlos. Just let me re-clarify. He's a week old. They found a clunk after doing the Ortolani's test, which you were talking about on day 2 of his birth, his second day of life. So that's why he's here today. We're gonna get him fit with a few things. I'm gonna run through what's called the Ortolani's test, just so I know about it a little bit more, what I feel, and we'll go from there. Okay, baby Carlos, I'm just gonna bring your legs up and out. Oh, whoa, yeah, see, did you hear that? That's Dad. Raw dad. So what I just did was brought his leg up and out, and see how it kind of popped out there?
Yeah.
It's not exactly what's happening, but he probably has what's called a shallow acetabulum. So that's what holds the femoral head in. This is the femur. So it's just kind of slipping out because it's probably pretty shallow. So we'll go from there.
Sounds good.
All right, Dad. So this is what's called a Pavlik splint. It's a kind of pretty tightly wrapped, almost nylon mesh type material. It's gonna keep his hips in this position, flexed and abducted, to help promote normal development of that acetabulum that we talked about.
Right.
So it works sometimes. For other babies it does not. We'll keep him in this for a couple weeks to a few months, and then we'll periodically recheck and see how things are going.
Okay. Thanks, Doc.
Yeah, of course.
Appreciate it.
So fast forward 6 months from now, based off of this real life case study, the baby ended up having surgery. The left hip healed on its own. The right hip was a little slower. 10 weeks after the harness was discontinued, it was determined that it was not successful, and the hip was subluxed and cartilage was in the way of making a full recovery for the baby. A closed reduction surgery with a hip spica cast was put on the baby. And that was all diagnosed with an x-ray. And the baby is now walking good because prognosis is great. So I have toddler Carson here, 3-year-old, with significant leg length discrepancy. His preschool teacher noticed a waddling or duck walk gait. Mom and Dad took him to the hospital. They did a screen there with a Faber and a Fadir test, and noticed the leg length discrepancy as well. They took x-rays, and Carson's been diagnosed with unilateral hip dysplasia, and that's why they're here today. Carson Hollenstein?
Well, this is us, honey. Let's go. Why do we have to be here again?
Mom.
Yeah, doctor, so her preschool teacher noticed her walking a little different, and so we just figured we should bring her in and kind of see what the next course of action is. I'm a worrier, and I didn't know what to do.
Yeah, well, first of all, you can call me Peter, or Dr. Peter. I really don't care. when I'm not here, I like to wear shorts and walk around with no shoes on, so it's pretty informal. Going on, I understand that you're worried about your child. I would be too. I have 6 of my own. I was reading, I understand that you're worried about your kids, and I read through the hospital notes here, so I see that he does have what's called unilateral hip dysplasia. It's not life-threatening or anything, and the prognosis with this is actually really good. So he has a good chance of having full abilities as he grows up and things like that. So to put some of those worries to bed. Now, I appreciate you coming in to talk to me because there's a good discussion about like having conservative treatment versus surgery. Unfortunately, for what little Karsten has here, I think that I'm going to go ahead and refer you back to the surgeon as this is a pretty significant hip dysplasia at this point. Do you have any questions about that?
So, surgery is our best option at this point.
In my opinion, yes, and I'm going to go ahead and let the surgeon talk to you more about that. He's a really good guy. His name's Baby Carlos. You might recognize him from the last scene, but yeah, that's all.
Thank you, Dr. B.
Yeah, thank you. Carson? So again, Carson had unilateral hip dysplasia. It was determined by the surgeon that it would be best for him to have periacetabular osteotomy. So like we learned in DKH, they cut around and reposition the pelvis. Carson was, after surgery, was placed in a full body cast, needed full assist with ADLs for a while, no bathing because of the full body cast. He recovered and eventually was able to start swimming around 7 years old and is living happily. Stickle McReynolds? Come on. Oh, my groin hurts. All right, so the patient I just saw, Stickle McReynolds, is 17 years old. He was misdiagnosed when he was younger. He has a 25% chance of getting osteoarthritis if his condition is left untreated. If caught early enough, though, we're probably going to do surgery. We caught it early enough. So I sent him back to the surgeon in town. Common symptoms include groin pain, walking with a limp, and a positive Trendelenburg gait. So they're more than likely going to do an FAO, a pelvic osteotomy, a hip arthroscopy, or a total hip arthroplasty if things are progressed far enough. Run, Stickle, run! I just like to run. 1 year post-op, look at him now.